Welcome, everyone. Thank you for coming to our webcast on workplace wellness, improving the quality of providing care. My name is Katie Volk, and I'm with the Mental Health Technology Transfer Center, MHTTC, of New England. We work around the region and with partners in other parts of the United States to bring best practices around mental health and mental health services to communities and try to share those with one another. I'm delighted today to welcome Allison Ponce and Kyle Peterson from the Center for Mental Health Care, CMHC Foundation. And I'm going to go over a few housekeeping things and then we'll turn it over to them. So, um, your microphones are all muted as you get here. At some point later in the webcast, we will invite you to unmute and share questions. If you have questions while we're speaking, certainly feel free to put those in the chat. You can also save them for, midway through the webcast. We'll open it up for questions and answers. So you can jot them down, or you can certainly put them in the chat there. If you have tech questions or tech issues, put those in the chat as well. And my colleague Vanessa will help support you on that. We are recording this session and it will be available to you on our website. Usually it takes about a day to get that up there. Certificates of completion will be sent at the end of the webcast via email. And if you have any questions at all, there's our email address, newengland@mhttcnetwork.org. We are providing this as part of New England MHTTC, which is SAMHSA funded. Just so you know, here's that information. And we really strive to be recovery oriented in our approach. So we use recovery oriented language. We try to be aware of being respectful, clear, and understandable, of being trauma informed. We know that everybody comes at this with their own background, history, culture, experience, and we strive to honor all of those things, and we humbly learn from the people that we're working with, and so we want to set that up at the outset. And so, without further ado, I'm going to hand this over to Allison and Kyle to introduce themselves.
Thanks, Katie. Hi, everyone. We're going to share some slides in a minute, but we thought we'd introduce ourselves without those sort of cluttering up the space. My name is Allison Ponce. I'm a clinical psychologist, and I work here at the Connecticut Mental Health Center in New Haven, Connecticut. Talk a little bit more about CMHC in a moment, but just wanted to give a little bit of a frame for my perspective. I am the Director of Education here at CMHC, and I think about and am paying attention to continuing education and other issues related to education of our ongoing staff at CMHC, as well as the mental health professional trainees who come to CMHC, dozens or so each year. And so July 1st is a busy time for us. We've just welcomed all of our new trainees, so education is sort of front and center in my mind right now. This is my colleague, Kyle Peterson. Would you like to introduce yourself, Kyle?
Sure. Thank you, Allison. And thank you, Katie and Vanessa. We're really delighted to be here today with everyone who's joining us. I'm Kyle Peterson. I direct the Connecticut Mental Health Center Foundation, which is a private nonprofit supporting organization for the Mental Health Center. And we provide emergency financial assistance to the people that we serve. And we also fund special and innovative projects that fall outside of the operating budget. So it's in that context that we're interested in innovation and staff wellness, in addition to providing for the needs of the people that we serve. I've been working in mental health services for now almost 25 years. I started as a garden director for a housing program in New York City on the Lower East Side that provided support to people who experienced homelessness and struggle with mental health and addiction issues. So my interest in mental health has been quite varied. I'm also an ordained Episcopal deacon, and I serve a church here in New Haven, Connecticut. So really delighted to be here and looking forward to our conversation after our presentation.
Great. Thanks. Well, here is CMHC. We're located here, like I mentioned, in New Haven, Connecticut. And CMHC itself is a pretty large mental health center, serves about 4,000 people each year who live with mental health issues and are in recovery. We are in a sort of moderately sized city, 130,000 or so people, and CMHC itself serves folks from the greater New Haven area. It's a pretty unique place in that it was established in 1966 as one of the first community mental health centers in the country. And from the beginning, and by state statute, CMHC is a partnership between the state of Connecticut Department of Mental Health and Addiction Services and Yale University. So it's a really interesting place that's run by a sort of diverse group of professionals, and it has a three-part mission that focuses on clinical research and education. Our services are both an inpatient and an outpatient. We have about 550 staff who come from the two different workforces I mentioned, from the state and from Yale, which provides a really great network of sort of expertise and perspectives, and also some challenges and interesting things that we'll talk about during our time with you today. And so while we do focus largely on mental health and recovery specifically, CMHC does have a partnership with a local federally qualified health center to offer an on-site wellness center here in our building. So many of you have probably heard of the triple aim, which is basically a framework for healthcare focusing on improving health and the experience of receiving care, and reducing the costs of care and being more cost effective. And more recently, a fourth aim was added, which focuses on the experience of providing care or providing provider satisfaction. And so there's certainly been some research on the quadruple aim, but there's not been a significant focus on how it applies to mental health settings and specifically community mental health centers. And a few years ago, we started getting interested in this idea and began to wonder if we could utilize the frame of specifically the fourth aim, this one focusing on provider experience and provider satisfaction, to address some issues that we are noticing in our system related to providers experiencing lots of stress and distress, turnover, and sort of the some burdens and concerns that people were experiencing in their roles at CMHC. So, as a community mental health center, we're working to address the recovery and mental health needs of a group of people who are notably negatively affected by social determinants of health. And I'm sure this is a concept that most of you are familiar with, but the folks that come to CMHC who are in recovery tend to experience low socioeconomic status, difficulty with things like access to healthcare and childcare and transportation. They're often under or unemployed, and may also experience housing instability and issues like food insecurity. So, our primary focus is and should be on helping our clients live well and safely in the community in the ways that they would like to experience their lives. There is, a relatively heavy emotional burden for a lot of provider staff who are working in partnership with their individuals that they're seeing for services to help them along in their recovery. So CMHC is also a really large organization, and it's owned and operated by the state, and it can have its own limitations in terms of things like flexibility for staff, autonomy, and creativity. So thinking about how this fourth aim might apply to CMHC was a good place for us to start thinking about issues related to wellness and the provider experience.
So one of the ways that we tried to operationalize the fourth aim was an intervention that we did in 2018, so prior to the pandemic, and had some ramifications that we'll discuss in terms of managing and dealing with the pandemic response. But it was something we called the Leadership and Innovation Lab. And the intervention here was to work with our clinical managers. So basically the middle managers from our system who were responsible for diverse and interdisciplinary clinical teams ranging in size from 50 to 70 cases that they were covering to 300 cases, and teams staffed by anywhere from 5 people to 20 or 25 people. And so you see in this picture some of the clinical managers that we worked with. Some of the assumptions that we made there was that the clinical managers were a leverage point within the system that could then influence other staff members and influence the quality of care that's being provided. And so we gathered them together. We met monthly for 7 months. We brought in some resources for them around project management, so some consultation around how to manage projects, and also how to identify and cultivate creativity and innovation. I remember one of the phrases that we talked about a lot was that stuck points are the beginning of innovation. So we really encouraged people to dive into points where they were feeling stuck as a team, feeling stuck as a leader of a team or a leader within a system, and to begin to think about what could you do to think creatively about addressing that stuck point that you're having. So again, we thought that by intervening at this level, this management level, it could have a ripple effect because these managers were responsible for a group of staff members. And if they could influence those staff members and change the quality of their experience of providing care, that could also read down to the quality of care that's being provided. The other thing that we added to this too was creating an opportunity for peer consultation and support. So after the 7 months of intensive meeting that we had with them, we supported them to meet on a regular basis to continue to bring issues and ideas to each other and to use each other as a resource and intervention. So then COVID-19 hit, and we were faced with a lot of challenges, as I'm sure all of you joining us were. We were faced with a rapid transition to remote work and telehealth, and I can tell you that we were in no way prepared for telehealth. We didn't have the equipment, we didn't have the software platforms to do that. So there's a lot of rapid learning that had to take place. Family and caregiving concerns that came up as we shifted, and people, we had a blended workforce of remote and in-person staffing. So issues around childcare, schooling, taking care of older adults was a real challenge. I mentioned that half of our services were remote or virtual, which means that the other half were in person. So we never really closed because of the nature of our work, our intensive outpatient services, intensive clinical and community services. We had staff coming into the building on a regular basis. We had technology and equipment limitations that I mentioned. We are working with a population of individuals that are particularly vulnerable. We already know that they had health vulnerabilities, mental health and addiction vulnerabilities. We also know, as many of you know, that people have physical health concerns. People who have serious mental health concerns have physical health concerns that reduce longevity. So people die 25 years earlier and are managing chronic diseases. So they're already very vulnerable people. I think we didn't say this explicitly, but all of the people that we serve have little or no income as well. So in addition to struggling with any kind of mental health or physical health issues, are impacted by the experience of poverty. We also had, in terms of structure and organization, to respond to COVID, we had various redeployments of staff to particular critical areas. So, and had this kind of persistent unevenness in remote versus in-person provision of care. So we responded in a few ways with regard to wellness and staff wellness. The director of the Mental Health Center made a public and explicit commitment to dedicating human resources to workplace wellness. So said that this is something that we are going to take really seriously and will do what we can to support that. As part of that, he appointed Allison and me as co-chief wellness officers, positions that we did not have, but now we do have. Folks putting in our hands a responsibility to really pay attention to this, to bring issues to him, to be creating those bi-directional conversations where we can really try to deeply understand and respond to the wellness concerns. And we came back to having introduced this idea of the quadruple aim prior to the pandemic came back to this question, like, how could we use that framework and apply it to a fluctuating and stressful environment? Would it have some meaning and significance, and could it help us direct the kinds of interventions that would be beneficial at this time?
So we've done a lot to try to conceptualize how to think about wellness in the organization. And of course, just based on this model, as you can see, we conceptualize the individual as being at the center of the model here, but being embedded in groups and teams, and then more generally being embedded within the organization. I think it's important to note that some of the, as Kyle mentioned before with regard to COVID, there were other environmental factors that were really impacting people's wellness at the individual, the group, and the organizational level. Notably, aside from COVID, racism, the murder of Black Americans really came, as you are all aware, to the forefront. And we noted, it was very important to note and very clear that the combination of the effects of COVID and the stresses of that, the effects of racism and the stresses of that really came together to cause a sort of a tornado of distress for a lot of people, not just individuals who are coming for care at CMHC, but also for our very diverse staff and workforce. And so we sort of explicitly decided to target a lot of our interventions and efforts at the group and team and organizational level, and with the idea that this would ultimately filter down into impacting individual people's sense of wellness. So, you know, we thought about a variety of different interventions to apply, and we had a sort of, let's throw it out and see if it sticks kind of approach. There was no map to use, as many of you are aware. Anyone who's thinking about applying wellness in a community mental health center in this time of incredible crisis knows that we didn't know what to expect or what people would really need. So our first step was to ask people what did they need. So we engaged in, I would put this in the organizational category, engaged in surveys and checking in with people and asking very explicitly, what is concerning you? What are you needing? What is impacting your personal life? What is impacting your work life? And I would say sort of a comment maybe we should have made at the beginning is that we are conceptualizing that even though only one subset of our 550 or so staff and trainees are actually doing direct care, that everybody in our building who works at CMHC, whether they're doing research, administration, education, helping maintain the physical plant, whatever it is, we are all working toward recovery. We are all working to support our individuals who are coming to CMHC for care. So this isn't just about specific experience of being a primary care for a primary clinician or a physician in our building, but everyone's experience of being part of this. So we asked everybody, where are you in the building? What are you doing? How are things going for you? What do you need? And that really helped us to design some of the interventions that we did. Another sort of organizational intervention was thinking about how do we connect people. One of the first things that happened was everyone scattered, right? As Kyle mentioned, we definitely had many individuals, hundreds, who were still working in the building, and that didn't change for them. But the other few hundred people all went home and were in different places. So we put together some opportunities that we called CMHC Connect, that again was sort of at the organizational level to create spaces for everybody to come together. We had these informal Zoom calls. We didn't have an agenda. They were really meant for people to do the kinds of talking and connecting that you might do at the water cooler or in the cafeteria during lunch. And so we're really thinking about offering these large scale interventions that were for everyone. But we also thought about team level and affinity group sort of interventions. We went to every clinical team and asked, Kyle and I asked them, how are you? What do you need? What's going on in your team? How can we be supportive? And we were really looking for sort of a cliche phrase.
Allison, I'm just going to interrupt you for 1 second because I think maybe when you're speaking, you're hitting something and there's a lot of background noise.
Oh, I'm so sorry to hear that. Okay.
Just be aware of to mention. Thanks.
Is that better, Katie, right now?
Yes.
Okay, thanks so much for letting me know. So we were also looking for things that were sort of easy interventions that could be done. We knew that when someone said, I don't have the technology I need right now to do my work, we knew that was a large scale issue that Kyle and I weren't going to be able to address. But some of the ideas that people brought to us were ones that we really could intervene on right then. We could turn to our boss, the director of CMHC, and say, hi, team whatever needs this thing. Can you help make that happen? And he'd say, well, yeah, I didn't know that was a problem. Let's make it work. So we were able to intervene for teams directly. And then with regard to affinity groups, I'll offer one more comment, then I'll turn it back to Kyle. In those CMHC Connect calls, parents and caregivers were experiencing and expressing a lot of distress around what their experience was like of having children at home, having family members that they're caring for. So we were able to develop a specific series of meetings that was ongoing until quite recently, focusing on parent and caregiver support. So it was a facilitated support group for several months, and then transitioned into a self-led or group-led experience, a sort of peer-run group. So I wanted to just give a couple of examples of those organizational and sort of group level activities that we did. And one of the things, as I mentioned before, that came up as such an important sort of environmental factor and personal factor was around race and racism. And there's an intervention I'm going to ask Kyle to talk a little bit about that focuses really on all three of these levels: the organizational, group, and individual.
Great, thanks, Allison. So if we just stay on this slide for a second, Allison is referring to something that's called Dialogues on Difference that we started at CMHC almost 3 years ago as a way to bring together people for difficult conversations, mostly focused on race, equity, inclusion within the context of providing care. It's something that's co-facilitated by the Director of Social Work and myself, and we meet monthly for these conversations, these facilitated conversations. And then something that we've also launched during COVID was racial identity caucus groups. So we have a white caucus group and a Black, Brown, and People of Color caucus group, in addition to the multiracial space that we hold for Dialogues on Difference. Again, this is not something that we started as a wellness effort, and it's not something that we started in response to COVID-19. It is something that we recognized was of benefit to the staff wellness, especially during these past 18 months, as Allison was mentioning, as racial issues in the country and in our communities were pushed to the forefront or became visible in different kinds of ways. So it was the dialogues was an opportunity to bring people together, again, at the organizational level, and then within the caucus groups to go to drill down even more. And we know from some of the conversations with people that had an individual impact. So what people were experiencing in their home communities, their neighborhoods, as in their families, was something that they were also able to process at work. So that's an example of something that pre-existed COVID-19, that as we looked in retrospect was something that was contributing to staff and workplace wellness at CMHC. In a way, we could sort of recategorize it as something that's beneficial to staff wellness. Another intervention that we had at the very start of the pandemic that also contributed to staff wellness was our director started regular center-wide meetings where he would provide updates on COVID and what the center was doing, and would take any questions, comments, ideas, thoughts, expressions of thanks and gratitude in those meetings. So in the early days of the pandemic, we were meeting daily for these Zoom conversations, and then transitioned to a less frequent schedule as the pandemic got, more under control. So we've shifted from 5 days to 3 days to 2 days, and now we meet once a week. So that's another example of an intervention that happened at the organization level, where people were basically being able to have access to the director of the mental health center to both hear from him, but also to ask questions of him and to create some openness and transparency around the communication.
So before we go into the next slide, I just want to mention a couple other activities we tried. And we'll talk a little bit more about this later, but as I mentioned, we tried a bunch of things and we thought we'd see what stuck and what people were interested in. We have a teaching kitchen here at CMHC and a chef and nutritionist that do groups with individuals in recovery and also with staff teaching about health and healthy eating and food and nutrition and wellness from that regard. And so when everything shut down and we went home, we had Chef Ann still, who's our wonderful chef, but no one to come meet with her at CMHC. And so we did some live streaming cooking classes with Chef Ann. And, at first maybe like 10 people came to that. And then it was like 5 people. Then at one time we had like just Kyle and me. We're like, okay, well, this was good for a couple times and it didn't go anywhere. We offered a class with a master gardener who was interested in talking about different ways that people could experience wellness through gardening. Our chaplain at CMHC offered a group called Spirituality Matters to offer that as a space for people who wanted to come to talk about that. We had a large vaccination champions initiative where several individuals who were early adopters of vaccines got some training about messaging and communications around vaccinations. It became available for anyone who wanted to ask them questions about vaccines, knowing that people in our community that we trust are people who are likely to help others be interested in accepting the vaccine if they had concerns or didn't have all the information they needed before they made that decision. And then food. Food was a big thing. We had grab and go breakfasts available as people started to come back in the building. We provided food for people to have picnics. There was a fall festival where people were able to come together and experience some food together. And if there's like one tip, I'd say food is always the thing that people are excited about and feel really nourished. And I think it's not just about, of course, the eating of the food, but it being provided to you and in a caring way. And that's obviously a very well-received activity that we did. So Kyle's going to wrap up the presentation here with some wellness lessons, and then we can move to discussion and talking more with you about your thoughts and experiences and anything you'd like to ask us about.
So yes, so these are some lessons, just some things that we observed in preparing to talk with you all today. Things based on our experiences. These are not best practices. They're not evidence-based practices. They're not things that we've tried and tested and run through randomized control trials or anything like that. They're just our observations and our thoughts about things that we found contribute to wellness. Leading off with appreciation, any opportunities to express appreciation directly for things that people are doing, especially during stressful times. So I mentioned we have the center-wide meetings. People are submitting anonymously expressions of gratitude for things that people have done. The other day we had some flash flooding and someone wrote in to say, thank you for making an announcement over the loudspeaker telling us to get our cars out of the garage so that they wouldn't be flooded. So it can be simple things like that. It can be, thank you for someone who helped me, navigate and support one of our clients in a particular kind of way. So any of those expressions of appreciation, anytime you can take advantage of that in a direct way. The other thing that we learned is the importance of invitation, to invite people to participate in things and not to mandate people to participate in things. I mentioned dialogues on difference that we hold. When we were meeting in person, we were sometimes getting up to 90 people meeting in one of our largest, but not really large enough to hold 90 people, conference rooms. And meeting on Zoom, we've had upwards of 100 people sometimes. And in our center-wide meeting, upwards of 100 people. None of those things are mandated. We invite people to participate in them. And we feel that that is an important thing. Related to that is this idea of offering things, offering and trying. So Allison mentioned we tried some things, and initially the uptake, the interest in it was significant, and then it waned, and so we stopped offering that. But the idea that we offer it is important. We also heard from some people that would say to us, I'm not able to come to, the parent group that you're offering, but as a parent, I'm so glad that it's being offered. I'm so glad to know that the organization that I work for cares about this and is offering something. Even though I can't participate, it means a lot to me that it's happening. So just the idea of offering is an intervention in and of itself. The other thing that we found related to these ideas of invitation and offering is choice making, that creating opportunities within highly structured systems, and ours is a very highly structured system, finding ways for people to have choices in how they manage their daily work is really important. So Allison mentioned we went around and talked with some of our clinical teams, and that was often a topic of conversation that came up is, were there choice-making opportunities? And related to that, are there opportunities for self-determination within this, again, highly structured system? So those things are related, not always easy to accomplish. We offer this as a wellness lesson as a way to think about wellness with a different kind of framework. So that within the structures of this, whatever kind of organization you're in, if you can create some more opportunities for individuals to make choices, that's really important. We also found that creativity and innovation is, really essential, and that under stress, two things can happen. It can wane and get burned out, or it can flourish. Because one of the things that we saw in COVID-19 was a lot of creativity in responding to very difficult situations, that things that we never thought were possible all of a sudden became possible. I mentioned early on the conversion to telehealth was something that was thrust upon us, and we had to respond quickly and creatively. One of the specialized services that we provide at CMMC is to deaf and hard of hearing clients. And we needed to, when you think about telehealth services there, we needed to rapidly respond to find technology, to find access to internet for those clients that we were serving, and to rapidly transition to a service that we hadn't been providing before. And there was a lot of creativity and innovation that went into that. And there are other examples that we can cite too. So again, these are just a list of observations that we made when thinking about wellness, that these perspectives could help you in your own particular situation. Anything you want to add to that, Allison?
Thanks. No, that's a great summary, Kyle. And we are not coming here as experts who know everything about wellness and community mental health centers and providing wellness for staff. But we wanted to share some of these thoughts, some of these experiences we had. We hope that the rest of our time can really be discussion based. We're happy to take questions, but also would love to hear about creative things that you've implemented in your settings and anything that you'd like to share about your experience. So I'm going to stop sharing there, and hopefully we'll be able to see everyone's Hollywood squares here shortly so we can all talk together.
Yes, I think Vanessa is going to enable something on her end to make that possible. But while she fiddles with the technology in the background, I just want to say first, thank you. That was really, really a helpful overview and so interesting. And it's so it's striking to me, and probably not a coincidence that so many of the principles that you just outlined, Kyle, are so similar and overlap so much with what is trauma informed and what is recovery oriented, right? It's just doing good human work in many ways, right? And so often it seems so simple, but so often I think we miss the boat on that. And so while Vanessa is tinkering in the background to enable participants to come on video and or to take themselves on mute, Vanessa, I don't know if you need to do anything or if that just happens automatically. I'll invite people to, certainly you can put questions in the chat box, but you can also raise your hand. If you scroll down to the bottom there, you'll see a little smiley face that says reactions. And you can, if you click on that, you'll see raise hand, and you can raise your hand and I will call on you. We're only doing that just because there's a lot of people here and we want to make sure we're not all talking over one another. And so I'm just going to pull up the participant list so I can see when you raise your hand, because that's always helpful. And in the meantime, while you're thinking of questions and typing and unmuting and doing all of those things, you know, Allison and Kyle, when I think about the word wellness, a lot of times I think people think about personal self-care and have I had enough water to drink and did I go for a walk today and have I, like, during COVID, changed out of my, comfy sweatpants and into real clothes to see real human beings? Probably not, right? But that's not the approach you took. You took a more systems or holistic kind of approach. And what was your thinking there? Could you talk us through that a little bit?
Sure. Yeah. Thanks for asking that. Those things you mentioned, like drinking enough water and exercising and sleeping, they are obviously very much related to wellness. But I also see them more as like almost human rights sorts of things. These are parts of just being human. And it doesn't mean we're all great at doing all of them. Every morning when I wake up and I'm feeling tired and my kids are on top of my head, I'm sort of, thinking I better do a better job with my sleep. But that's not necessarily something that CMHC is going to be able to help me accomplish. So we decided that, yes, we could think about offering like virtual yoga or other sort of activities like that. But what we realized is that, especially in a time of stress, so much of what CMHC could offer was about the sort of environment and about connection. And those things benefit individual well-being, they accrue to individual well-being, but we thought our best shot at really helping as many people as possible was thinking about how we are interacting together and what we as a center could offer in terms of support and really bolstering the team interactions and keeping those teams whole, helping, I mentioned before that we have a mixed workforce of state and EL people, and that is wonderful in a lot of ways. It also creates a lot of stress. So what kind of equipment you have in your office might be determined by who your employer is. Whether you could use Yale's HIPAA compliant Zoom versus Microsoft Teams, which is what the state of Connecticut uses for its that's what the state approves for its employees to use for telehealth. People like Zoom better in our experience, but if you're a state employee, you can't use it. So there are some things like that that are really complicated. And we thought if we can really build our team, that will ultimately hopefully help people feel better. And of course, at the end of the day, we want providers and our whole staff to have good wellness, but we think that benefits client care and our work in recovery and our ability to help the people who come to CMHC for services. And so we see it as a big it's an all-encompassing approach if we consider the organizational and team level.
Yeah, it becomes a culture of wellness rather than an individual responsibility. It needs to be a both and, is what I hear you saying.
I think too, Katie, another thing that we did was we had a monthly email where we shared tips and resources and articles, and some of those things like about sleep or about mental health needs, particularly among children, things that we heard people talking about, we were able to provide those resources to people. So it was another, again, that's an organizational intervention because that's an email that we would send out to the entire organization. People could use the information as they will. The other thing I would say too is that intervening with the affinity groups, so like convening the parents, they might then talk about sleep or diet or food or those things, but it's actually in the context of the intervention at the team or affinity level, not at the individual level about what are you doing about your sleep.
Yeah, that makes a lot of sense. I wonder, and folks, I've got a bunch of questions here that have come into me privately and that we've thought of, but if you've got questions or comments or you've tried things in your own organizations, please feel free to use the chat box or raise your hand here and we will call you into the conversation because we want to make this conversational, of course. One of the things I'm wondering is that what were the things that were the most successful that you tried, but also what didn't go well? I think we learn as much from what didn't go well as we learn from what was successful.
We mentioned food.
Food's good. The food was very successful. And the teams, back to the point of creativity, when you offer something, teams get very creative. So all the state employees were mandated to come back on June 1st. And they had about 2 weeks notice that they had to do that. Yale employees are not mandated back in person until August 1st. And even then, it's not clear if that's going to be a hard and fast, like you need to actually be back in the center. So on June 1st, we started offering a series of sort of food events. There was a welcome breakfast. There was, lunch available for everybody on one day. And then we do have some clinics that are not based here in the primary center that are based in ones in West Haven. There's a substance abuse treatment center. And so we contacted those folks too and said, we want to bring lunch to you also. And so Kyle packed, we have a cafe here that provided lunch. Kyle packed it in his car and drove it over to one of the groups. And they had a sort of team meeting and had lunch. And then another group, our West Haven clinic, they said, you know what, we were hoping to have a goodbye picnic for our trainees and staff who are leaving and welcome our new people. And could we pick the food up and go to the beach for a picnic? And so, they had the creative idea to go to the beach and have this gathering together. But it's the first time their team had been together in person in a year and a half. And they took this offering of the food and took it with them and created this really great experience for their team. And then we got multiple emails from their team saying how much they had appreciated that. And so it's just some simple things like that. And then you mentioned that, we do learn from the things that don't go well. And I couldn't agree more. And for us, that helped us really think about shifting and pivoting and changing gears. And in a system like ours, it's so big. Sometimes I feel like it's like a freighter ship, and we're like everything is hard to change and move. This really freed us up to say, you know what, we're just going to keep trying things, and maybe there are some lessons for us to learn, not just in our work as the wellness officers, but more generally at CMHC. Like, why do we do all of these things the way we do them? It's because we've been here for 50 years and it's just the way it gets done? Or can we think differently and more creatively about getting rid of stuff that doesn't work and trying new things? And so we're actually seeing some changes in that in our center and more generally. Kyle and I are doing a project now with our director looking at the meetings that we have in CMHC. Do we need the 50 or so committees that we have, or could we do our work a little differently? Do we have to meet every week? Could we meet every other week? Like, just really thinking about ungluing ourselves from the old ways of doing everything. And so I think this lesson of some of these things worked, some didn't, got us thinking in a different way about change and creativity and pivoting.
I've seen those shifts across different kinds of systems, for sure. Like, oh, well, we used to always do my son came home from school one day and said, oh, we did math outside today so that we could take our mask break. And I thought, oh, that's great. Like, I don't know that it would have, his teachers are wonderful, but I don't know that it would have occurred to anyone to do math outside pre-COVID, but they did. They brought blankets and sat on the, right. Yeah. Anyway, Kyle, it looked like you were about to jump in there.
Well, one of the things I was going to say is, I mentioned that we had staff who were working in person and then staff who were working remotely.
Yeah.
An observation that we made that was really, really interesting is that our staff who were working in person actually expressed a high level of satisfaction. There were stresses for sure due to COVID and managing that situation. But what we heard from them is that they enjoy working with people. They want to do the work that they were hired to do.
Yeah.
So our folks who were working remotely were struggling much, much more than those who were not. So when we think about wellness, and Allison and I, as we met with teams, we're always very clear to frame wellness in this kind of way: that do you have the resources? Do you have the self-determination? Can you make the choices that you need to make to do the work that you enjoy doing? Mm-hmm. And that is what's going to contribute to your sense of wellness and efficacy in the workplace. And we assume will also have a ripple effect to your coworkers, and a ripple effect for sure, and a direct effect on the kind of care that you're providing and how people are experiencing that provision of care. So that was really interesting. So our inpatient unit, the most intense unit,
yeah,
it was like, yeah, we're kind of okay. It was also that their life was not as disrupted. It was disrupted in some kind of ways with the addition of new protocols, but they still went to work, left the building, had their routines that were taken away from people who were working in a remote situation, didn't have visual cues to their daily work experience.
Yeah, and I think that idea of routine, and also it struck me, Allison, when you were talking as well around like that human connection and sharing a meal and the power in that and the healing in that. I think when that gets taken away, so suddenly it's not that the work at home routine isn't okay, it's that it's so different and I'm lonely for colleagues, or I'm not able to do the work in the way that I've been doing it. And that's a loss, right? That I think many people have grieved, even in the midst of all of the other hardships, and the idea of self-determination as well. I'm just checking the chat here to see if anybody's got their hand up. Like I said, folks, if you've got any questions, certainly feel free to type them in the chat box or put up that hand. We just have a few more minutes here, and I'm wondering if you were to give a piece of advice for teams that are listening to this and thinking like, oh, maybe we want to try something like this, or I love the idea of a wellness officer. What advice would you give to people just starting out in this kind of shift?
I would say try it.
Try. That's good advice for life in general.
Yeah.
I think for me, part of this was trying to have fun too. Like, so there was so much that was hard and difficult and stressful as the pandemic was coming on, and so much changed. And part of what Kyle and I thought about was like, what would make things lighter for people? What would make things fun for people? What are some, like, I mean, who would have thought that having Chef Ann she taught us a better way to cook quinoa, and she grilled pizza, on Zoom in her backyard, and my kids were sitting there watching it with me because they were home from school because there was no school in April or whatever it was, and so I really just think trying to think about having some fun. It helped. So Kyle and I are friends, and we've been working together now for 16 years as of this month. And so it was also very nice to be able to partner with someone. And so I think, a lot of organizations were so strapped in terms of human resources, and there's not a lot of energy to go around. And so really trying to find someone to partner with, it was a wonderful thing for us that we got to do this together. I shouldn't speak for you, Kyle, but I'll say for myself, to do it together was really wonderful. And it eases the burden of one person trying to like start a whole new thing from scratch, where we started from zero, basically. So thinking about partnering, thinking about how to make it fun, and just trying it, as Kyle said.
And I'm seeing there's a comment from Allison Hill in the chat box saying that it's taken some time she's had to take some time for her own mental health to figure out what is the thought process and what does our back to normal look like. And I think that's, so I commented in the chat box that our normal has shifted so frequently, it's hard to know what our bearings are. And I see she's saying here, even now, like, you have to be cautious, right? Because numbers are going back up and the protocols are changing. And I remember them changing like week to week and day to day. Certainly in May and June, especially, it becomes hard to figure out what's okay and how do we connect and what is that?
I remember, this is Allison I'm talking now. I remember when Governor Abbott, I'm in Texas. I remember when Governor Abbott lifted the mask restriction, and oh my God, everybody went crazy because everybody wasn't ready for it. Some people have been vaccinated, some people hadn't, some people still don't want to get vaccinated. So it's like you still got to be precautious about what you're doing, where you go. And a lot of the stores and stuff have lifted the mandate where you don't have to wear a mask. So you still have to be protective of yourself.
Yeah. And navigating that when your boundaries are one way and other people's boundaries are another way, and families and school settings and shops and health clinics, it becomes just an added stress for sure.
And I think, as you're pointing out, that it just keeps shifting too, that you think you've got something you understand it, it's under control, and then something shifts. We remember this from the early days of, talking about masks. Like, we had our staff saying, can we wear a mask? And this was like before the CDC was recommending masks. No, you can't wear a mask. Then you have to wear a mask, but you can only wear this kind of mask. If you just trace the whole mask conversation over that, it will make your head spin, So part of it, I think, is trying to bring some personal connection into that. I think communication is really important vis-a-vis wellness. So that center-wide meeting that I mentioned is not just about the delivery of information. It's about creating a culture where we can ask questions, we can hear the information that we need to hear, but we can also raise questions about things that are concerning to us. And that helps, with the anxiety that is attendant to all of these, these issues. I think another example, we mentioned that early in the pandemic, we did these things called CMMC Connect, which was trying to sort of mimic water cooler conversation and, hallway conversations. And then we did CMMC Reconnect when people were to return to work. The sessions before people were required to return to work on June 1st, we had a lot of people and a lot of anxiety. As soon as June 1 hit and people were back, the anxiety level came down, or it shifted, and we didn't have anyone come because they were at work, and so being responsive to the very changing on the ground situation is important when you think about wellness too.
For sure. We are primed to connect.
One that it's probably similar in other the environments of other people who are on the call as well, is we have a very diverse sort of set of services that are being offered. As we mentioned, we have inpatient care, we have a transitional living unit, we have a lot of outpatient. In those outpatient teams, some are in the community, some are in the building. They're all very different. And I think it was a challenge to really consider how to offer things that could be applicable in different settings. And when things like, for example, offering a parent and caregiver support group at 11 a.m. on Tuesday, that works really great for a lot of people who are doing outpatient stuff and who have more flexibility with their schedules. But a nurse on the inpatient unit who's on shift right then is not free for an hour to get on a computer and join a group. So we thought about how can we deploy some resources to support everybody in the building. So we worked with a social worker colleague who did some consultation on our inpatient unit. What they were needing was some more help thinking about diversity, equity, and inclusion issues, and wanting to talk about that from a support perspective. And so he did some groups with inpatient staff, and the inpatient arranged for their staff to be able to rotate in and out of that meeting, even though they were on shift during that time. So really it was a challenge, but also a great thing, I think, to need to think creatively about delivering opportunities to everybody in the building. It may not look the same from unit to unit to unit, but making sure everybody was offered something.
Allison and Kyle, I want to just thank you for all of this good information and the honest conversation and the ideas and the creativity. I want to thank everyone in our group here for participating and thinking these things through. I'm going to toss it to Vanessa, who's going to close us out with a few final kind of next steps. There's a second part of this webcast series she'll talk about, and I look forward to connecting with all of you in the months, weeks, and years to come.
Thank you, Katie.
Great. Thank you so much, Katie. And thank you, Allison and Kyle, for today's presentation. It was a wonderful presentation. So as Katie mentioned, we do have a second session coming up. It's taking place on July 28th. It's called Organizational Restructure to Promote BIPOC Employees' Wellbeing. So this one will be more focused on how can we support our BIPOC employees. So you can find that on our website. I can also put a link in the chat momentarily that will take you to that registration page. And also in the chat, I'm just going to post our evaluation link. It would be really great if you just took a few minutes to fill out our evaluation, which allows us to continue to provide resources such as these today. So I will put that in the chat right now. And again, it would be really appreciative if you could fill that out for us. If you do have any questions after today's event, please email us at newengland@mhttcnetwork.org. So I'll put everything in the chat for you right now. So here's our survey link. If you could please take a moment to fill that out, that would be great. And then our email address is coming out in the chat right now for you, newengland@mhttcnetwork.org. And on our website, if you go to on your screen right here, you should see our website. You can find all of the resources, all upcoming events that we have. We also have a podcast that you can listen to. Feel free to just peruse through our website for anything that you may find appropriate. And again, thank you everyone today for attending, and thank you Kyle and Allison for this wonderful presentation today.
Thanks.
Thank you, everyone.